everyone, and welcome back to my channel. My name's Sophie, and this channel is a journey of finding a diagnosis for what is wrong with me, hopefully the treatment, and eventual recovery. So today's video, I thought I would just sort of go through what kind of symptoms I've been having since March of 2020, what doctors I see, and what tests I've had done. So I have my cheat sheet, so let's get started. So in general, I have severe fatigue. Some days I'll sleep up to 18 or 20 hours, and it's not a normal type of fatigue. I could be sitting here doing something, and I'd literally just fall asleep. That's how bad it is. So that's been going on pretty much since March or April of 2020. Since I've been wearing the oxygen, it has gotten a lot better. I also get chills a lot. You'll probably notice as winter goes on in some of my videos, I will have a hat on and possibly a blanket wrapped around me. And I'm normally always cold, which isn't too new, but even during the summer, it could be 80 degrees in the room and I would have chills and need to put a blanket around me. On the other side, whenever I do an activity like walking up the stairs, bringing groceries in, going for a walk, I feel extremely hot and overheated. I'm sweating more than I should be for such an activity, and when I've taken my temperature the few times I've remembered to, it has been slightly elevated. Now I'm not sure what normal is in respect to that, but I do know walking up the stairs didn't used to cause me to sweat or feel overheated. Sometimes I will take off a layer when I get upstairs just because I'm so hot, and then once I cool down, the sweat evaporates, then I get chills and the layers come back on. I also have joint pain sometimes, normally if I've been exercising, quote, a lot. So if I go for a walk multiple days in a row, if I go on the exercise bike multiple days in a row, my ankles, knees, and hips will hurt. I am having some left shoulder pain as well. I'm not sure if that's because that's only the side I sleep on, but that's been going on. I get muscle twitches, and sometimes it just feels like my muscles are vibrating. I'll think I have a phone in bed with me when I don't. Or sometimes I've actually thought there was an earthquake going on because I just felt that vibration type of sensation. Then, as I think I've mentioned in another video, when I do any repetitive type exercise, like brushing my hair, brushing my teeth, stuff like that, my muscles will burn like I'm doing a light workout with a lot of reps. And again, that's something the oxygen has greatly decreased. At the beginning, so through April through maybe through the end of last year, I would get random full body itches, for no reason. There's no rash, there's nothing there, but my whole body would just itch intermittently. And this was happening about every other month, every couple months, and that has since stopped. But since coming off birth control pills, which I was on for 20 years for cystic acne, I was getting a hormone-related rash about a week before my menstrual cycle. Thankfully, I'm now 7 or 8 months since stopping the birth control pills, and that has decreased a lot as time went on. I've had the enamel chip off my teeth, and it wasn't a cavity. You could see the layers of the enamel and the tooth. It was really weird. The first dentist I saw said they didn't know what it was from. They gave me a prescription fluoride toothpaste, which I still use twice a day. When it happened again and I went back, the dentist said it was from oxygen use and dry mouth, and there wasn't really anything to do except try to keep my mouth moist and to use the toothpaste daily. And I do some other things. I have mouthwash that has fluoride in it, and I have the Biotine gel, just trying to keep my mouth moist, because oftentimes I will wake up and my mouth is gummy. It's so dry. When it comes to my hair is definitely thinning. The last time I got my hair cut, I was asked if I knew my hair was shedding, to which I answered, of course I know. The hair on my legs also grows a lot slower. I used to need to shave my legs, for example, 2 times during the week, like in the summer, to wear shorts. Now I shave about every 2 weeks. I should probably shave about once every 10 or 12 days or so, but it's just easier to do it when I shower every Sunday. That's sort of my routine. Similarly, I just got a new tattoo on my arm, and for those who have never gotten a tattoo, before you get them, they do shave the area. So the area they shaved still has no hair growth at all, and it's been 2 weeks, so my hair does grow slow. And I'm not gonna lie, it's nice not having to shave multiple times a week, but I do know that it's a symptom of a larger issue. I also mentioned in, I believe, my part 3 video that I'm having urinary issues, and that has gotten progressively worse over time. I'm now having to strain to urinate almost every time, definitely the majority of the times, and I very rarely urinate like a normal person. You sit down and you urinate. That normally doesn't happen. I also have some abdominal distension. I'm not sure what it is. I have had abdominal MRIs, and I don't have any ascites or fluid in my abdomen, so it's not that. I'm not sure if my abdominal muscles are just weaker, so everything's just sort of falling forward, or if it's just fat gain. I really don't know. And then quickly going back to the urinary stuff, I did have a cystoscopy, so they went in and looked inside my bladder and everything looked fine. And then urodynamic studies where they put probes inside your bladder to measure the muscular contraction, and that was abnormal, so my bladder does not contract like it should, hence why I am not urinating, and the urologist thinks it's a neurological problem. So in January, I am seeing a neurologist for that and other issues, which I will get to here in a moment. So hopefully we can figure something out on that front. And on my skin issues, I have not seen a dermatologist. That's sort of at the bottom of my list, but it is on my list of appointments to make going forward in 2022. Moving forward to my neurological symptoms, I will start out by saying I have had a brain MRI without contrast. It was normal. I asked for an MRI with contrast because the urologist said it's not uncommon for females my age who, if they have urinary problems like this, which is rare, that it is a neurological disease such as multiple sclerosis. But my doctor didn't want to do the MRI with contrast, so I'm waiting for the neurologist. So, other neurological symptoms. For a while, I was having a lot of headaches. I was having headaches almost daily that just wouldn't go away no matter what I took. Word finding difficulties, concentration difficulties, memory difficulties, all things I still struggle with to some degree. Again, the oxygen has improved that a lot. When I was on the prednisone back in February through May of this year, that also helped that a lot. I also have difficulties with fine motor control, mostly my right hand. I did ask for an occupational therapy consult, which I didn't get, so I take it upon myself. So what I do is I make little feed animals. These are my Christmas ones. I also made some Halloween ones. So that's what I do to try to gain some of that fine motor control back, but I do think that is deteriorating as well. I am off balance or lightheaded sometimes when I change position, which could also be related to my blood pressure, which sometimes can be very, very low. And then sometimes I have these weird sensations that my head is falling backwards or that my eyes are rolling back in my head. Now, I live alone, so I don't know if these things are actually happening or if I'm just feeling like they're happening, but it can be quite disconcerting, especially when I am driving. I have noticed it happens more regularly when I'm driving, especially when I am very tired. Not sleepy tired, but just sort of fatigued tired. So I do try to not drive long distances or at all if I need to when I know I am not 100% mentally there. And normally I can tell if something's off when I get out of bed in the morning. I'll sort of drive into the heart stuff Sometimes when I wake up, my blood pressure is very, very low. I have almost passed out numerous times. Things get sort of white and fuzzy, and things sort of continue to get fuzzy overall until my whole vision goes white. And I know at this point I am a few seconds away from passing out and I need to lay down instantly. So I've laid down on the floor, I've crawled from the bathroom back to my bed. When this happens, sometimes I don't really know which way is up, so it can be hard to get off the floor. Those type of episodes I've actually been having since childhood. They used to be very, very rare, like once a year, and this year so far I've had multiple episodes. Since I've been keeping track of my blood pressure, I've noticed when this happens, my blood pressure is very, very, very low. Now, whether it's my blood pressure causing the issue, or if it's the issue causing the blood pressure, I have no idea. Again, that's something I will definitely bring up to the neurologist in January. Also, when I talk a long time, like I'm doing right now, I've been talking for 11 minutes now, my face and lips, so from here on down, starts to tingle. I'm not really sure what that's about either. Again, I will talk to the neurologist in January. Going back to the heart, I've seen a cardiologist as well as a pulmonary hypertension specialist who's a cardiologist. So I've had numerous tests done on my heart. I've had multiple echocardiograms. I've worn a heart monitor. I've had a cardiac MRI. And then related to the cardiovascular system, I've had Dopplers on my legs, both with and without a reflux. And what the reflux will help them see is if you have any venous insufficiency or problems getting blood back from your legs to your heart. So with all that, I've had pitting edema. I still have pitting edema. I wear compression stockings almost 24/7. I do take them off sometimes. My legs get really dry, as do my arms. So I will take them off to lotion my legs and sort of let my legs get some air. And sometimes it just starts hurting when I wear them a long time. It had gotten to a point where I couldn't wear shoes or socks. My legs were so swollen, and that walking down the stairs by the end of the evening was very painful. I'm on a diuretic now, so I've lost a lot of fluid weight, but I still have the pitting edema. It is not nearly as bad as it was, so I am grateful for that at least. I have my heart rate increases more than it should with activity. Walking up the stairs, it can go anywhere from 100 to 140. I don't really know what causes it to go higher sometimes than others. I'm assuming speed has something to do with it, but not always, so I'm not sure what's going on there. My heart rate will also increase, oddly enough, if I'm just like chugging fluids. My heart rate increases, and sometimes when I'm done chugging the fluid, I'm short of breath as well. I can also see my heart beating through my clothing. I have videos of this. Maybe I will put one up at the end of this video. That would probably be the easiest for me to do. I'm not good on inserting stuff within the video quite yet, so I'll put a video up if I remember that. But I can just be standing up first thing in the morning and see my heartbeat through my clothes. I also see it during the day as well, just going through the day. When I look down, I can see my clothes moving with my heartbeat. Sometimes I can also hear a swishing or whining noise. Now I will have a murmur at times. The doctors can hear this, but I've been told they have no idea why I can hear it, as it's not loud. I have weak pulses. My blood pressure is very hard to find. My doctors have a very hard time to find it manually. And with that, I also have this weird thing where if I'm wearing like a chest strap heart rate monitor for my smartwatch or my Garmin fitness watch and wearing a pulse ox at the same time, at times the pulse ox will be dramatically lower than my chest strap. So my chest strap might be saying my heart rate is 130 and my pulse ox will say it is 50 or 60. I don't really know why that happens. It's happened throughout this whole journey. It's happened with multiple different pulse oxes, multiple different exercise types. It's happened when I was in pulmonary rehab. They don't know what's going on. And the pulmonary hypertension specialist. Cardiologist I saw sort of just dismissed it as being something with the pulse ox that was wrong. I kept saying it's happened with multiple pulse oxes, but he just said they were wrong. This doesn't happen as often, but I will get chest tightness with activity. So again, walking up the stairs, heart rate's increased and my chest will just feel tight. Sometimes I feel like I need to like roll my shoulders forward, like to loosen my chest, because like my heart area will feel tight. And there were times when I was also getting chest pain at rest. That doesn't happen nearly as often as it used to. Again, the oxygen has made a very big difference. I've already touched on the orthostatic hypotension, or my blood pressure being severely lowered upon standing. I've had a couple episodes where my heart just felt like it was fluttering, like it was beating really fast. I wasn't wearing a pulse ox or chest strap heart monitor at the time, so I don't know what it was really beating, but that definite sensation that my heart was beating super fast. Normally, if this happens when I'm in bed, it's happened a handful of times, and when it happens, I'm so freaked out by it, like I won't move, like I will just lay there and wait until it passes. Then I've had one episode where my heart was beating so hard it hurt, like the pounding of my heart with every beat was painful. And then I've posted pictures that my lips and skin complexion will just not be normal, that will be a grayish color, sometimes with a bluish, purplish tinge to it. Again, with the oxygen, most of these symptoms have improved. And then, finally, for my respiratory system, I've seen a pulmonologist, and in January I will see a pulmonary hypertension specialist who is a pulmonologist. Woo! As far as testing goes, I've had pulmonary function tests, which were deteriorating. I've had CT scans, both normal CT scans, CT angiograms looking for blood clots, which I did have in May of 2021, and then high-res CT scans that take images while you're breathing in as well as images when you're breathing out. And the breathing out images is what you normally do not see on a regular CT scan. And those images, when you compare them over time, have also deteriorated. I will eventually do a whole video on my CT scans. I've had capnography done. I had a very high respiratory rate. When I got one of my procedures done, they wanted to keep me overnight to see what was going on. And my respiratory rate at the time was 27, and I was just relaxed sitting in my bed. But my carbon dioxide was normal, which is what they're measuring with capnography. Then I've also had numerous bronchoscopies where they stick a tube in your nose and down into your bronchia. And I've had this both done sedated as well as awake, and awake was for me to breathe so they could see what part of my trachea is collapsing and how much it is collapsing. And like I said in a previous video, I think I will be getting another one of those done in January, both awake and sedated, to figure out what's going on and to have a stent placed. Other things other than shortness of breath and needing to catch my breath after activity, my oxygen saturation by measured on a pulse ox will drop. Sometimes with activity, I posted a video of that. It doesn't always drop, and again, with the oxygen, it doesn't drop really at all now. Maybe into the low 90s when I walk up the stairs, but nothing like it was doing before. I already mentioned the abnormal pulmonary function test. I've done my arm raised before with the weird sound. I've talked about my trachea collapsing, and I've also had low oxygen when I'm in bed lying on my side. It is normally lower when I'm on my left side versus my right side. Again, that is without the oxygen. I've also had tons of blood work. My latest blood work showed that my inflammatory markers were high, which is normal with an autoimmune disease, but they were higher than they normally are. So I will be seeing my rheumatologist in February, and I do have blood work scheduled in the next couple of days. and I've had multiple COVID tests. All of them have been negative. Every time I get a procedure, I get a COVID test. And for a while in 2020, every time I was hospitalized, I also had a COVID test. So I've probably had 15 or 20 of them by this point. Looking forward in the future, other than the blood test, I have the right heart cath coming up after Christmas, as well as a tilt table test to see if I have postural orthostatic tachycardia syndrome, which again, I don't think I do. I think it is more orthostatic hypotension. I'm also supposed to have a cardiopulmonary exercise test done, but because of the shortage of materials, they don't have something they need for the test, so all of that's on hold. And then I've said the bronchoscopy with the stents. Now with the right heart cath, they are going to have me exercise during it, so I don't know what all that includes. But yes, that's been my symptoms for the past 22 months. I lost track. So that's what I'm dealing with. Again, it's not all of it every day. It's not on a regular basis now that I'm wearing the oxygen. But that is what I've been dealing with for the past almost 2 years now. And I've been talking for 21 minutes, and now my whole face is just tingling. It tingles. I don't know how else to describe it. So, I'm going to end this video. I am sorry it is so long. I do not think I will insert any videos at the end of it. I will upload them separately. And I will talk to you guys next time. Bye!